The sisters got off the train in 1895 to teach, but very rapidly realized that no one was providing health care here. So they reached out to the community, rented a small home, and started caring for people. The very first patient was a young child with tuberculosis. They took him in and cared for him, but he died. They realized that education was important, but it was even more important to care for those who truly needed them the most. That is how it all began. The community helped them raise money for the very first 6-room house that was St. Joseph's. Then it was expanded to 22 rooms, and then to a new facility. It was really about the people in this community that gave them dollars to help them relocate to where we currently are, and who have been an important part of the real healthcare environment, the research and the teaching, and all of the things that make St. Joseph's special. St. Joseph's Hospital and the Barrow Neurological Institute really have, I think, incredible physicians. And we call them the doctor's doctor. So that when your physician who's caring for you doesn't know what else to do, they pick up the phone and call us.
About 5 years ago, we had a faculty of approximately 50 to 55. Today we have a faculty of about 155. These individuals support many of our teaching programs and support our research and enterprise here as well. I've seen the hospital add a new tower, the neuroscience tower, which has brought 144 new beds to the organization and made us the largest hospital in the state of Arizona. I saw that our emergency room almost doubled or tripled in size, so that we now can care for the almost 70,000 patients who come to our emergency room in a year.
And we were incredibly fortunate to attract some of the brightest individuals, whether they be neurosurgeons or neurologists or neuroscientists. And with it, our expertise grew, and it attracted more and more patients until we arrived at the level where we are today.
We have now a lung transplant program. We also do some complex thoracic work, such as complex esophageal surgeries. And many of these things, such as transplant and esophageal surgeries, were previously leaving the state in order to get care.
Having a level 1 trauma center is important to a community because the patient that's very, very injured, you have the golden hour, in other words, to, in essence, snatch them from the jaws of death. You have to have the resources available. You have to have a surgeon here. You have to have an anesthesiologist here. And I mean not call them up and have them drive here and be here in 20 minutes, but down in a matter of minutes. Here, we have a very deep bench. We're doing operations around the clock. Our MRIs are humming around the clock. The amount of expertise that's available at the snap of a finger is amazing. And that's what's wonderful about working here.
That's the kind of place this is. We have some services that you can't get anyplace else. So we're providing basic services for the citizens of this state and the area, the community, and also world-class, particularly in neurology and neurosurgery.
Trauma patients, neurosurgery patients, brain tumor patients, back surgery patients, patients that other doctors across the United States have given up on. We see many of those where our doctors will see them, consult with them, and decide to take the case and actually do them a great amount of good that they would never get anywhere else.
I think our staff is different here because of the way they care for our patients. It's nothing to see a nurse stop and pray with a patient or a family. They reach out and exceed the expectations of the families and the patients.
What makes them different is the culture that we grow here, the culture of the Sisters of Mercy. It's hard to put your finger on, but it's in the air, it's in the water, it's in the culture. It's what we expect. The expectations are high to work here at St. Joe's, but absolutely every employee works and strives to meet those expectations.
They welcome very much the families, and we do family-centered care. They're compassionate and passionate about children's health care. It takes that kind of a person to work here.
That's the only way we can work down here is as a team. Everybody relies on everybody else, from the HUC to the doctor and everything in between. It just mesh. It's a beautiful thing the way it comes together.
You know, I love coming to work every day because it's a new experience. You're going to learn something new. You get to look at the x-rays and the CAT scans, and you get to ask the doctors questions, and they're always willing to explain it to you or show you. And then to see the patients who smile or who come back after they're well to give you a thank you card, just to say you made a difference.
I think one of our core values is dignity. It's a please and thank you. It's calling a department ahead of time if you're running late. It's talking with an employee in a private environment rather than yelling down the hall. It's making sure that employees really respect patients and visitors, making sure that we're there to really help, so the dignity word is easy, but the operationalizing it and making sure that people understand what it means, I think, is really important.
Well, we have approximately 365 clinical trials at the moment, which is a very large number for a hospital system. With that, we also have another 70 in progress. We started a DNA diagnostics laboratory, which is where we can take experimental findings here and actually put them into assays that we can use to make for diagnosis of patients. So we have that capability. It's a CLIA-CAP approved lab, the only one in the state.
Our program is the state program for biochemical genetics. There is no other biochemical genetics service in the state. And so all the patients with what are called biochemical genetics patients all come to St. Joseph's Hospital. We are the contract holder for the newborn screening program, so any children who are picked up by the newborn screen come to our office for treatment.
We need the doctor who says, why is it that I have cured this patient and I haven't affected this patient? And as a result of that, research is critical.
In our lab, we do brain tumor research. We're interested in why tumors resist therapy, and also working on some novel therapies that we think might be very good when added to the standard chemotherapy and radiation. We have a program called Scientific Enrichment Program for Students. Students in the lab feed into those projects, and they also are ambassadors to the community to tell people what kinds of research we're doing here.
Well, this is a teaching hospital. I'm here because I'm a teacher. We're interested in helping provide more physicians for the state of Arizona and this population. The way that you do that is to help train residents and medical students.
The fact that St. Joe's is a teaching hospital is a huge magnet for the community, for the nurses out there, the ones that have done their clinical experiences here. They all want to work here, and they want to work with the residents and with the teaching opportunities.
St. Joseph's Hospital does several programs that promote safety. Barrow's Helmet Your Head program provides bike safety and helmet use. Children Are Priceless Passengers educates parents about the correct use of child safety seats and the importance of child passenger safety. The Oliver Otter Water Safety Program teaches children and their families how to be safe around water. We also participate in joint projects with the Fire and Emergency Medical Service departments to prevent injury.
We have a beautiful new clinic that is absolutely gorgeous, the Momobile. By being right in their neighborhood, it enables them to have continuous prenatal care, which is the goal. We want to have healthy moms and healthy babies.
I think the legacy that was started will continue on. The community benefit that this hospital provides is huge, and that is a treasure for Arizona. This is the largest hospital in Arizona. The amount of care that we can provide for those that are less fortunate is huge, and I don't know of any other hospital in the valley or in the state that really has that as part of their mission, part of their mandate.
10 years from now, I would see a different approach to delivering care. First of all, it's going to be more personalized. We have the technology today to look at your genes and know what medications that we give to you will actually improve your health. And I think you're going to see incredible advances in cancer care, in prevention, that we all have to take responsibility for our health care. But we're going to be able to help you know where are your areas that you are most vulnerable. So it really is a different way to treat people.
What helps for the future of St. Joseph's Hospital is that we're here for another 113 years, that we're still valued in the community, we're still seen as the hospital that takes care of the poor, the hospital that takes care of individuals who have very complex medical issues, and the hospital that professionals want to come to because it's a top-notch hospital and we do all the right things.